If we remember the party scene that Will and Jake were at, there was a wide assortment of drinks at the party, the majority of which were alcoholic. This is almost always the decision to be made at any party scene. What drink should I drink? Alcoholic or non-alcoholic? And if alcoholic, should I drink beer, wine, or hard alcohol? If non-alcoholic, should it be water or soda? Alcohol will impact our control on our bodies and minds because, again, it affects our nervous system. It is considered to be a depressant because it slows down the transmission of messages in the nervous system. It can make us react more slowly to things. If underage, the decision is a hard no against alcohol. Underage drinking is almost always seen as alcohol abuse, unless one's parents have offered it at home. For those that are of age, the divide between alcohol use and abuse is difficult to define and is often gauged by the individual's use. Any emergency room visit, as a consequence of alcohol intake, is due to alcohol abuse, for sure. Certain reactions to alcohol intake, such as unusually poor decision-making, such as driving or having a physical reaction of vomiting, is characterized as abuse as well. Other responses, such as a loss of physical balance, is also characterized as abuse. However, light drinking at a party or dinner that is balanced by water or food intake, which avoids the awful consequences of alcohol, can usually be seen as social drinking, which is not abuse. In contrast, drug abuse is much easier to define. At any point, if drugs are taken for purposes that are not medicinal, such as for fun or for pleasure, drug intake is defined as drug abuse. Sometimes during parties or events, drugs are often present, and friends that use drugs either for medicinal or abuse reasons may offer them to you or to me. Again, there's a decision to be made, yes to drugs or no to drugs. However, this time, if the decision is a yes to someone other than your doctor, then it's a yes to drug abuse. These drugs can be recreational, those purely used for fun, and also prescription drugs that many people use for medicinal reasons. Those drugs that are recreational act on the nervous system by affecting how the user feels, thinks, sees, or acts. They can either act on the neurotransmitters, aka the messages themselves, or the receptors of the messages. Those drugs that speed up the transmission of messages are known as stimulants. Those drugs that slow down the transmission are known as relaxants. Let's talk about a few common drugs. Marijuana, which is made from a cannabis hemp plant, is one of the most common recreational drugs that young people use. Oftentimes, the drug is used in the form of a handmade cigarette. Slang names known as weed, pot, grass, reefer, ganja, Mary Jane, blunt, joint, roach, nail are all representatives of the drug marijuana. Blunts are often laced with other dangerous drugs such as cocaine, PCP, or embalming fluid. What exactly is marijuana doing to our bodies? Marijuana affects the central nervous system by affecting the user's self-control, including coordination and the sense of time. It is a relaxant. Long-time use can lead to mental illnesses in some individuals. However, the impact of marijuana extends past the nervous system. It affects the lungs, and there are more than 400 chemicals in marijuana, and a single joint contains 4 times more cancer-causing substances than a normal cigarette. It also affects the immune system by lowering the body's ability to fight off infections. According to federal law, the sale and use of marijuana is illegal. The addictive nature of marijuana has yet to be proven. Some users claim to be addicted to it, while others claim the opposite. Let's talk about another common drug, cocaine. Cocaine is made from the coca plant. Slang names include coke, dust, toot, snow, blow, sneeze, powder, lines, rock, and crack. It can be snorted as a powder, injected with a needle, or processed into a crystal to be smoked. What does cocaine do to our bodies? Cocaine is a stimulant. It speeds up the central nervous system. It also creates a short euphoric high and is often replaced by irritability and depression. It can make the user feel paranoid, angry, and anxious. Cocaine also often affects many other organs. Users often do not eat or sleep regularly. They can experience increased heart rates, muscle spasms, and convulsions. The tissue in the nose are often also damaged if the users snort cocaine. Cocaine can cause extreme responses such as heart attacks, seizures, strokes, and respiratory failure. In contrast to marijuana, cocaine is biologically addictive. Users need more and more of the drug just to feel normal. Those addicted also lose interest in other areas of life, such as school, friends, and sports. Another common substance abuse involves inhalants. Inhalants are never used for medicinal reasons and are often the vapors of chemicals such as glue or paint. These vapors affect the central nervous system because users can get high after sniffing them. After the high, users can often feel dizzy and confused and often slur words. High doses or long-term use can lead to death. Users may often intake inhalants by smearing a chemical on the side of a paper bag and breathe from the bag. This is extremely dangerous because users can get an uncontrolled and high dose of a chemical, leading to dizziness, fainting, and even death, caused partly by the lack of oxygen. As mentioned before, the abuse of medicinal drugs, such as prescription or over-the-counter medication, is another form of drug abuse. This form has become more common in recent years and often leads to serious consequences such as death. Abuse includes taking excessive dosages, more than the amounts prescribed by the doctors or recommended on packages, as well as mixing medications with others. Both excessive dosage and mixing drugs have dangerous side effects. Painkillers, sleeping pills, tranquilizers, and even common cold medication can cause serious health problems. As a rule of thumb, it is only advisable to take the recommended amount of medication for a sage dose. Also, if drugs need to be combined with others, find out from the doctor or pharmacist if it is safe. Thank you.